everybody, and a very warm welcome to this month's vlogcast. I am delighted to welcome Orlando Agrippa from Sanius. Sanius we are in partnership with, as many of you will have heard on our patient day recently, in developing an app. Thank you for agreeing to join me, Orlando, and I'd love you just to tell the community a little bit more about the plans for the app.
Thank you so much, Nona. It's an absolute pleasure to be here with you. I'm Orlando Agrippa. I head up Sanius Health as the Chief Exec and Chief Patient Officer. I think to your first question, so we have been working with colleagues at MPN Voice, both clinical and sort of voluntary and the sort of leadership team for quite some time in developing and delivering a solution that is very much patient-focused, patient-centric, and fundamentally what the app or the patient wallet is designed to do is to allow people living with MPNs to be able to capture their quality of life data on a daily, weekly, monthly basis, which predominantly looks at how you're feeling, how you're getting on living with this condition. And fundamentally, what we've built into that ecosystem is element of patient support and coaching. We've built in an incentive program. So every day that you complete your outcomes within the patient wallet, you get 5 points. Those points aggregate up into incentives like Uber vouchers for transportation and or for dinners or whatever people use them for, Amazon vouchers, trips, etc. Because for us, we believe that people living with hematological disorders should have something different and extraordinary as part of their outcomes journey. But above all of those things, what we are preoccupied with is using the patient wallet or the app to be able to empower patients to really engage with their own health in a very different way. The patient wallet and app allows you to bring in your medical records into the platform, but also connects into an FDA-approved wearable device, which tracks a number of things. But I'll pause there for a second, and I hope that's helpful. Nona, does that respond to the first question?
That is amazing. And I think a very simple question that I have for you is, what happens to the data? Because as patients, the data is pretty private. And what assurances are for patients on the data use?
Excellent question. So as an organization, most, if not all of us, come out of the NHS or the National Health Service. And the principles around data governance, data handling and data processing mirror that of the NHS. So at any point, once consented into the patient app and or ecosystem, patients have the right on the GDPR to withdraw, and we have to honor that withdrawal and remove any identifiable data that's not already kind of built into any parts of the sort of research journey. In terms of how important this is to us, so as part of our own internal data governance, security, and processing strategy, we use sort of health cloud, which is the same that the NHS uses, to be able to store and manage data in that way. But at every point throughout the journey, patients' data are managed confidentially. So, for example, I, as chief exec, will never know who you are, Nona, within the ecosystem, or who, I don't know, Orlando too is within the ecosystem. So I'm never allowed to see names or any identifiable details. What we've got is a really specialist team who focuses on ensuring that all patient data is kept securely, handled ethically, and that patients always have the right to understand the use or how that data is being managed, but also have the right to withdraw from within the ecosystem. Does that help?
That's really helpful and really reassuring, because it's a whole new world with so much data that's available, but sensitive data. I think it's very reassuring for people going on to the app. Now, how soon will people be able to log on to the My MPN Voice app?
Yeah, it's so at the moment we are in testing with colleagues at MPN, Guys and Thomas's, and others, to be able to ensure that though the platform is already built and ready, that every single outcome metric is very specific and curated around the MPN community. So at the moment we are testing and curating to ensure that patients or people living with MPNs have the most extraordinary experience within the ecosystem. At the moment, our plan is to have that available pre the holidays for patients and their families to be able to engage with. But that's, we're almost there, but pre-Christmas is what we're looking at.
And for the wearables?
So for patients who might not know how and what the wearables are, so what we have been doing, I'm a patient living with a hematological condition, like many in the MPN community. And we've been fortunate to help hundreds, if not thousands of, or quite a lot more than that, of patients in different hematological malignancies and disorder communities. And we've been doing that for the last, 3 years in multiple ways. What we've been able to do as part of our approach to the ecosystem is bring in an FDA sanctioned and approved wearable device, which allows patients to automatically, so you don't have to do anything. So it's got a 30-day battery life, and it allows patients to automatically capture their sleep, blood oxygen levels, ECG, heart rate, activity, etc., and also temperature. And for people living with MPNs, these are really important, and or blood disorders, these are really important metrics. So the wearable comes as part of the bundle with the patient wallet. So what you get once you're consented and signed up is you get 1, a welcome note, 2, an email from the patient support team who will be with you throughout your journey. 3, within 3 to 7 days of your access being approved, you will get in the post an FDA-approved wearable device, which captures all of the things that I've just described. You will get a few extra welcome things, but also access to the patient wallet or app, which then allows you to start engaging with your own health data in a very different way. But fundamentally, our preoccupation is to help patients and people living with this condition and others to have extraordinary outcomes and a better quality of life.
That sounds really great. And will there be a cost for the wearable?
You've got tons of amazing questions there. So the short answer is no. So at no point, and if anyone has that discussion with you, then that would be inappropriate. But at no point do we have any commercial relationships with patients and or carers or their families. Everything that we do, though we are a sort of limited company, everything that we do with patients is free for patients and carers, because the genesis of Sanius is on the basis that we fundamentally want to help people living with rare and long-term conditions to have better quality of life without it costing them more. So for us, there is no transaction between us and patients, or MPN and patients in this case. And our relationship predominantly is to deliver and to support patients with having an extraordinary health journey and better outcomes.
That is excellent news. And the future is really bright with that. And I was sitting there thinking, for a lot of people, if another illness happens, or they find themselves in A&E, they'll have all the information at their fingertips to give doctors in, that are caring for them in different settings.
It's a really good point, Nona. You know, I think I mentioned to you earlier that my own not that long ago, I had a bit of a sort of a health issue with my own long-term condition, and I was able to send the outputs from both my wearable and my patient wallet or app to my hematologist to say, this is how I'm feeling. And he was able to mobilize the appropriate levels of support around knowing what's happening to me in between contact. Because the challenge is that when you're not with your doctor, they have no way of knowing. This allows you 4, 5, 20 steps closer to improving visibility of your care in between contact.
Sounds amazing. And I can't thank you enough. And this is an amazing partnership with MPN Voice. And I'm hoping that in a few months' time, we can have another conversation to see and look at the progress that we're making in moving this whole project forward. Thank you, Orlando. And on behalf of the community, thank you and your team for working with us to provide such a new, valuable initiative for MPN Voice.
Thank you so much, Nona. The pleasure is mine.